time bomb, would you say?
That is the worst thing about HIV. Because of the latency period, 10 years the person can have the virus and he can be walking around as healthy, neat looking, but he's as dangerous in terms of the possibility of passing on the virus to anybody that he gives blood to, he shares blood with, he has sex with, whether it's a female to a female or a male to a female.
Doctor, I think we've said quite a bit on this show and others about some of the problems we call crises in the healthcare system in America. And what you're saying now is that, that there's a greater problem coming down the road in terms of the impact that this will have upon our healthcare system, because I know it certainly would have to have a tremendous impact.
Well, we haven't seen anything yet. I mean, in terms of what is yet to come. At this point, we believe that we have counted about 192,000 cases as of now, and we believe that for every one case, there may be 10 people who are infected. So along the way, the explosion is going to come. We believe that, of course, it's a leveling off among some portions of the population, among white males. It's leveling off. We believe that they have gotten wiser. They have lowered their risks. But among other groups of the population, especially among black females, black teenagers, we are seeing the infection rate still growing. The new cases are rising among them. And these are the very persons who haven't got the health care support. But what I'm saying in short is that the worst is yet to come. Before maybe some future time, we might see a leveling off. But the worst is yet to come on its impact on the healthcare.
Doctor, not long ago you spoke to a group of ministers at the Farm and Home Ministers Institute at Tennessee State University, and you talked about the church and AIDS. And I'd like for you to sort of repeat some of that information that you gave in terms of the church's attitude. This is a Sunday morning, and quite a number of people are watching who are church people, quote unquote, and in a real sense, they might be interested in what you might have to say about how the church ought to react to this disease, or should the church react to this disease?
Well, at this point, I know the church is caught in a bind, and the church is the leader of the community, so they have to lead the community, in the sense that whether it's about social issues, whether it's about religious issues, the church has to be a leader. And in this issue about HIV and AIDS, they are moral issues as opposed to religious issues. The church, there are some who oppose the church mingling in this issue and talking about condom use, for example. There are those persons who believe that the church must not touch it. But HIV is not going anywhere. We are stuck with it forever. Take it this way. Even with gonorrhea, with syphilis, where the latency period is very, very short, you can see the symptoms, and we've got a cure with penicillin or whatever drug we have. We haven't even been able to control syphilis, gonorrhea, and whatnot. HIV is not going anywhere. It's going to get worse and worse and worse. The church, if it wants to maintain the leadership role, must make a stand and say, this HIV is affecting the people. For example, among black people, the man is infected, the woman is infected, the teenager is infected, the child is infected. We are talking about a whole family being wiped out. We are talking about a whole community. If you don't know anything about it, let them look at what's happening in Africa, in Uganda, in Kenya, where a whole village is infected, just because they haven't had the courage to talk about it, to do something about it. The church must take leadership and say, yes, we have a problem of HIV infecting the people. Whether or not there's a moral issue about it, in terms of talking about sex, in terms of talking about drug use, this is a war against HIV. It's a war. And war must be fought with innovative ways, innovative means. That is my message. They must be part of it. We cannot pretend that it will go away. We cannot pretend that things are going to change. It will not change. And the church, the reverend ministers, the clergy, must join with agencies like COPE agencies like Natural Cares to fight against this disease. That's the bottom line of my message.
Now, COPE, why don't you give us some information about COPE and what COPE has been able to do dealing with the churches up to this point, Doctor, because I understand that, that you are involved in going into various areas with that organization.
Well, COPE, what we are, we think that we are only a means to reach the community. We have an outreach section where our staff go out to the community, reach to anybody who wants to listen to us. We talk about the data, we talk about issues about women, we even show them condoms, how to use condoms. We have education programs where we go to the community, to churches. Anybody who invites us, we shall be there. And we have a support group for persons, HIV persons, persons who have been infected, to come to us, sit down. We want to help their families to deal with the disease itself. Now, we have been trying to work with the church in the sense of bringing the pastors together, and then they're showing them what the situation is, how